The Orthopædic Institute for Children is dedicated to providing world-class orthopedic care for children.
We take care of a wide variety of children from all over greater Los Angeles area, even down into southern counties and even down all the way into Mexico.
We have 3 pillars to our mission: outstanding clinical care, research, and education.
Orthopedic Institute for Children has a very strong alliance with UCLA, and as a matter of fact, our core faculty provide all the pediatric orthopedic care for the UCLA system, including the Mattel Children's Hospital.
There's a growing need for an ambulatory surgery center to cut wait times, to provide care for those who might not otherwise get it, and to address the needs of the underinsured.
It's very important to understand that what we do here actually changes the lives of these patients. If it wasn't because Orthopedic Institute for Children in this location, these patients will not have a place to go and receive the orthopedic care that they so much need and deserve.
At Orthopedic Institute for Children, physicians saw 60,000 patient visits last year, and over 80% of those were underinsured.
The biggest issue we have right now is very long wait times, and getting access to surgical facilities at outside institutions can take 6 to 8 weeks sometimes.
Children now experience tremendous delays in care. Families have to do tremendous amount of additional work or jump over big hurdles to get the care that children deserve.
This ambulatory surgery center is going to give kids the care that we would all demand for ourselves.
We had a patient, Rafael, who came into clinic. He was an 8-year-old boy, and his parents brought him in because they noticed he wasn't as active as he used to be. That his knee didn't look the same on one side versus the other, and that seemed to be getting a little worse. By looking at him, doing an exam, taking some x-rays, that his kneecap wasn't in the right place, that it was actually in a completely different place, and it was something he was born with. It's going to be 6 to 12 weeks before we can get to you. We have to tell him, you can't play with your friends, and telling an 8-year-old boy that is very devastating and difficult.
Having the surgery center here will actually reduce that time, and it will increase the opportunity for those patients to receive the care that they need here in one center at Orthopedic Institute for Children.
I like to run, I like to jog. I'm in love with playing sports.
ACL injuries are increasingly common in children because of the increase in athletic participation, particularly in young children.
And I was running, and I felt a sharp pain on my right knee.
It's important to seek treatment with an ACL injury because with the instability that results from the injury, the meniscus and cartilage within the knee can be further damaged.
I went to her doctor, and they told me that it was just growing pains, it would go away, but she still kept saying that, you know, she had pain. As a mother, it's very frustrating. I want to do something for her.
So when I met Christine, she had already been to several different physicians after a knee injury sustained while running.
I was worried that it could be something damage to her knee that maybe later on she wouldn't be able to do. So what she likes to do, running, playing, or sports. So getting to Orthopedic Institute for Children, they took us in right away. They examined her, took x-rays. We saw Dr. Bowen, and he felt confident that he can help Christine and help her with that pain that she was having.
Initially, it was diagnosed as a knee sprain, but it became clear that she had an ACL, or anterior cruciate ligament injury. It was important to do her surgery in a timely manner to prevent further damage and unnecessary suffering and pain. Unfortunately, Christine's story is not that unique. We see many children who injure their knee, sustain ACL injuries, and experience prolonged delays before getting treatment. This risks further damage to their knee, unnecessary pain and suffering, and I think that's why an ambulatory surgery center would be so helpful.
I did surgery on a patient, Benjamin, who had unfortunately been hit by a car.
And I saw my son, his leg broken. I feel very horrible because he was playing football for 3 years.
Unfortunately, he was brought to a hospital where there was someone there who didn't know how to treat this injury in children.
And every month I asked the doctor, "Doctor, his bone is like this. Why?"
In the child's follow-up, the bone was not healing. And the only way they were going to get access to the additional surgery needed is if they were going to pay cash.
So I told her, "You know what? I don't have this money." And he said, "I don't care. You need to pay."
This was a working family that didn't have the ability to pay for the surgery.
5 months, I saw my kids to go to school with a cast. And he told me all the time, "I'm tired." And him changed.
By the time they arrived at our doorstep, had been not walking and in a cast for 8 months. No child should ever have to be in a cast for 8 months, using crutches and unable to use their leg because of an injury that should be, immediately addressed and taken care of within a couple weeks. Having a surgery center here will, I am very confident, reduce the number of Benjamins out there.
Downtown has become recognized, I think, as the center of the region. The clinic downtown, not only did we provide services that kids need, but we provided to families that otherwise might not have any access to service at all, which is just one of the amazing things about orthopedic.
It will allow us to have the control and the capability to treat children from beginning to end.
The Ambulatory Surgery Center will be a state-of-the-art facility in the basement of our clinic building in the heart of downtown. And it is going to allow us to be able to treat our patients in much, much faster and shorter times to actually get the surgeries that they need.
This is not donating money to the abstract. This is donating money to something that months from now you will see it change children's lives.
Corporations in LA or family foundations or public foundations, I think they should be involved with the Ambulatory Surgery Center campaign because there is such a rich history of OIC being part of this city and this community for 103 years.
An investment in orthopedic not only helps our community, but it helps the youngest members of our community who are going to grow up and have productive lives and help other people. So to me, that's the best possible reason to give.